So, update on my bunion surgery. Friday would have been my third week. It's been harder this week than any other week, actually. I'm back to work. I've been back to work for about 2 weeks. I was doing admin work for a week, and then this week I'm doing my regular job, but I've been basically seated the whole time, and I'm a counselor, so I have my clients brought to me. So that's not so bad. I'm seated the whole time. There's no issues with that. But ever since my stitches came out and I had to shower normally, my area where the wound is from the stitches just got a little too moist, and it just doesn't look right. Sometimes it hurts. I did talk to my doctor last week, and they sent me some more antibiotics just as a precaution. He said it didn't look completely affected, but when it's moist, it could just create an area of infection can occur. So I'm dealing with that. It's a little more painful this week to walk with the boot than it was even post-surgery, but hopefully everything will go fine. I'm sure things aren't expected to be perfect, and there's always a hiccup along the way. I'm still walking. I'm still doing what I gotta do, just staying off my feet most of the time. So I only walk like 5 minutes to 10 minutes an hour as recommended by my doctor. And I would show pictures of the foot, but it's absolutely disgusting. So I'm not going to. Just that it's moist. It just didn't seem like it was perfect. So I had sent that to the doctor. But that's an update. So post-op, about 3 weeks, not as easy than it was the first 2 weeks. It's almost a middle stage where you can move around more with the boot, and I'm even back to work, but because I'm moving around more, if I do a little more, just a tiny bit than I should, it hurts a lot. And then sometimes it just hurts because it didn't hurt for a while, and then I go to sit down and I probably like have some swelling or something like that from just doing a little more than normal. And also just my skin healing, my bones healing, all of that apparently does hurt. So from 1 to 10, I'd say it's between a 5 and a 7 most times. So that's where I'm at. Hopefully next week I see the doctor on Friday. Hopefully things will be a lot better. One thing I do recommend is Bentadine, which is basically iodine. That seemed to help a couple days, just putting it with a little bit of a sterile gauze. Some people had told me to keep the foot out to let it dry out. Some people told me to keep it wrapped, but my doctor specifically told me to keep it wrapped. He wants the compression, so I'm doing that. And I'm keeping it unwrapped for at least 15 minutes after showering so that it's not moist when I go to wrap it and it's dried out. Also, I don't know if it's a good idea or not, but my mother, she's Dominican, and she had some home remedy of crushing some aspirin and putting it on the wound and said that it does help. I was doing that initially, and it looked a lot better than when I stopped doing it. I stopped doing it for like 2-3 days, and then it started getting really moist. So today I put some crushed aspirin, really finely crushed aspirin. She had said that that is like a home remedy to help close wounds and help with the pain. So it has been helping. It doesn't hurt as much as it did yesterday, and I'm hoping that it keeps it more dry and it helps it close. So that is me. Please do not take any of this as expert or doctor's opinions. This is just me trying to get through my post-op time. Goodbye.